Right, thank you very much once again to the Mayor for joining us this morning and sharing those thoughts on how we go forward to improve employment and skills across the West Midlands. We're now going to move on to our first panel session. So I mentioned earlier that one of the things we've been arguing for at the Learning and Work Institute since 2022 is for an 80% employment rate ambition for the UK. That would mean an extra 2.4 million people in work and match some of the world-leading countries like the Netherlands. And we're really pleased that the Labour government has picked that up as their ambition, and so they want to deliver this through reforming job centres and joined up local work and health plans, and the youth guarantee that Richard was talking about there as well, and doing this in partnership with the nations and combined authorities and other local government across the UK. So our first panel is going to talk about some of that and how we get there, what we need to do to make it happen. So could our panelists, who are hopefully in this room, otherwise I'm going to be talking to myself, could our panelists please come and join me on the stage? So we have Jo Bibby, who's the Director of Health at the Health Foundation, Fiona Aldridge, who's the Head of Insight at the West Midlands Combined Authority, and I feel like I'm doing a game show here. Come on down. And Rachel Perrin, who's the Associate Director of Operational Programmes at Sense. And if you just want to grab any chair that takes your fancy. And Gareth Parry, who's the Managing Director for Citizen Services at Maximus. Right. Thank you for joining us all this morning. So I'm going to just go in the order that you have aligned yourselves in, which thankfully actually is the order it's on my paper. So thank you for doing that. You've made my life a lot easier. I'm very simple. So we're going to start just with some contributions from each of our panelists, sort of a few minutes thought from them about how we achieve that higher ambition, what we need to do to get there, and then we've got plenty of time for discussion and debate from everyone in the room. So, Jo, shall we start with you?
Yeah, thank you. So the brief was what do we know and what don't we know about work and health. So the kind of first thing was, how many things do I have to know before I can start telling you about what I don't know? I reckoned I got 5 things I was going to say that I think we know, and then 3 where I think we need to know more. So the first, and this isn't a surprise, we have a problem with working age health. It often gets talked about in terms of the 2.5 million people who are economically inactive on health grounds. But I think one of the things we also know is that actually we've got kind of quite a precarious element of the workforce with 3.8 million people who are working but have a work-limiting condition. So I think they're the kind of the people who are at risk of falling out of work if we aren't really thinking about how we support them. The second thing we know is that this has been getting worse. Just one way of illustrating this is some analysis that colleagues at the Health Foundation have done that shows that the level of 16 to 35-year-olds today who report having a work-limiting condition is the same as what 45 to 54-year-olds were reporting 10 years ago. So we're kind of seeing this sort of rising tide of ill health amongst younger people, which is at levels that we would have 10 years ago expected to see amongst people in their 40s and 50s. So I think this is really a concern, and something obviously that we were kind of hearing, I think, from when we were hearing about the West Midlands challenge. I think the other thing to be concerned about this is that we know that kind of health progresses through our lives. There's a kind of cumulative impact. So the sooner we start having health problems, sadly that means that those are likely to compound and get worse. And we're also seeing more people now with multiple conditions. So it kind of gets more challenging to think about how do you support the workforce when they may be having, diabetes, anxiety and depression, musculoskeletal pain and so on. The third thing is that working age ill health isn't evenly distributed. And is not a problem that's going away. So we've done some work at the Health Foundation where we've been looking at projections of health to 2040 and not just what's going to happen with overall health based on the demographic and trends in disease and risk factors, but also what's happening in terms of inequalities in that health. And we know that by 2040, there'll be 2.5 million more people diagnosed with major conditions, that people in the 10% most deprived parts of the country are going to be diagnosed 10 years earlier than those in the 10% least deprived. So that's starting to creep into people's working lives increasingly. And that of the 700,000 more people with working age ill health, 80% of those are going to be in the more deprived parts of the country. So it's not evenly spread around the country, it's not evenly spread around the workforce, and that's a real challenge. So just to speed up a little bit, fourth point, there's no simple solutions. We know that. This is a multifaceted problem, it needs long-term action, it's hard, it's a whole society problem. But we talk about thinking it in terms of three things. One, how do we help people who are currently out of work get back into work? But actually that's probably one of the hardest things to tackle, we know that. We also say we need to be really paying attention to how we keep people in work who have health challenges. But fundamentally, as a society, we've got to start thinking about how we actually see people's health as an asset and something that we kind of protect and invest in over the long term. So just three things I think we don't know as much about and we need to be thinking hard about is, in terms of the conditions that are kind of always coming up as the sort of highest causes of people being out of work or having ill health, mental health, musculoskeletal, diabetes. I think the mental health area is one that we need to know a lot more about. How much is it about different patterns around reporting, different sort of acceptability about that? How much is it about different incidents of disease? Clearly that's, a part of it. I wouldn't be dismissing that for a moment. But I think there's a more complex problem there that we need to understand better if we're going to respond to effectively. I think also when we're thinking about MSK, we talk about MSK, musculoskeletal problems being one of the big challenges. But, what's driving that and where does obesity play into that? And if we're really going to start thinking about how we address some of the causes of this ill health, we've got to be thinking more broadly. And what that means for things like our food system, for affordability and availability of good food, and for marketing and so on. And then I think the third thing that we don't know, and maybe it's different this week from last week, but is what is the appetite for action on this? A healthy workforce, I think we know, isn't a finite resource anymore. We have a limited supply, but we're only going to increase that supply if there's some really serious concerted action taken. Thank you.
Great. Thank you, Jo. Yes, lots of food for thought there, and there's definitely lots. We could have listed lots more things that we don't know as well, I think, as well. So that's actually part of the discussion, I think. Fiona, over to you.
Great, thank you. So I'm Fiona Aldridge from West Midlands Combined Authority, and I work in a directorate that brings together skills, employment, health and communities, and that's really important for us because actually it's only by bringing those things together in a place that we think we can tackle some of the challenges and get to that higher employment rate that we've been talking about. Now, you've already heard from the Mayor, but just to say a little bit about the West Midlands and some of the challenges and opportunities, we think the West Midlands has enormous economic potential. You know it as the birthplace of the Industrial Revolution, and our job is to make sure that it's the forefront of the next Industrial Revolution. And there's lots of opportunities here. So our economy is about £100 billion. We've got 92,000 businesses. Actually, at the minute, there are 67,000 vacancies across the region. So there are lots of opportunities. But there's some real challenges too, and thinking about how we get people into those employment opportunities is really important. But it is complex, it is persistent, and it is long-standing, and there are no silver bullets. Thinking about our labour market, most of our adults are in work, as they are across the country, but employment levels are below the national average, and too many people actually are stuck in low-paid, insecure work, and so we need to do as much to help them get good work, as well as moving new people into the labour market. As you've heard from the Mayor, youth unemployment is a major issue for us. It's high, it's rising, but we've got persistent levels of high unemployment across all ages in parts of the region and among particular groups. as elsewhere, an increasing proportion of our workforce is experiencing ill health, and a growing proportion of our residents are out of work because of that health. So we've got this with individuals, but at the same time, our businesses say we've got vacancies, we've got skill shortage vacancies, we've got restrictions on our labour supply. And so our challenge is to think about how we can respond to that with the powers that we have. Within the region, our main lever, as Richard has already mentioned, is through our skills investment. We want to bring a lot more to it, but skills is what we have devolved at the minute. And so we've really tried to think differently, to think about how we use that to develop programmes very much very connected to employment opportunities, buying programmes of learning and support, not just qualifications, that will enable people to access really good jobs, but have the right support to enable them to do that as well. We've worked really closely with our partners at DWP, our health partners, our local authority partners. It will take all of us to be able to work together if we're going to get people into work. We've got some great products, so swaps, Construction Gateway, our boot camps, and really making sure they are tied into good jobs and the right support is really critical. We've also raised our low wage threshold, so the point at which training in this region is free is currently if you earn less than £32,000, because we recognise we need to be able to help as many of our residents as possible afford training that will help them get that first job, a better job. And then we're really trying to build on our successful youth hubs to think about how we extend that for more of our residents, to bring together employment, support, health, community services, to create a sort of drop-in accessible facility where instead of accessing lots of different facilities and an individual has to run around after them, actually those services are fit around that person and really helps them succeed. We have also, as Richard said, really tried to think hard about our work with employers. So we need to support individuals, but we need to encourage our employers as well. So a couple of great examples, the Path 2 programme that Richard talked about, where we're trying to support 19 to 29-year-olds into good apprenticeships by putting great training and wraparound support. But we're also really excited that we've just started working with DWP on a job rotation pilot. So that's basically working with employers to release existing staff to uptrain, and then with DWP to be able to put people who are unemployed into those placements and to train them as well. So we think that'd be a great way of getting more people into the labour market as well as upskilling our existing workforce. So some great things we've got there, but really hoping that through further devolution and being able to put those employment support and skills and health services together, that we can hit that target and really improve the lives of residents in this region.
Great. Thanks, Fiona, and some really good practical examples there. I really thought you were going to say the West Midlands was the birthplace of Jude Bellingham there, but you went with the Industrial Revolution, which I accept matters as well.
I mean, maybe slightly less so at the moment.
We'll delete this from the recording tomorrow if it all goes wrong. Rachel, over to you.
Hi, I'm Rachel Perrin, and I'm the Associate Director of Sense's charitable programmes. So Sense is a national disability charity that we support and represent the 1.6 million people in the country with complex disabilities through our social care, but also through our charitable programmes. And through our charitable programmes, we also provide an employment programme. We run 3 employment services currently, one in Birmingham, one in the East Midlands, and we run a virtual service and we'll be expanding to Leeds next year. Our services provide advice on welfare and benefits, employability skills workshops, and assistance with applications, so everything from someone thinking about whether to start education, volunteering, or going into the workplace and through once they start their career with their employers. We are in quite a unique position, so our programmes aren't statutory funded or commissioned. We have donations from our individual giving programme, and also we have philanthropic gifts as well, which enable us to design a package of employment support around that person with complex disabilities, and we're not constrained by time or very rigid framework of support that we can provide for people. Sense also commissioned some research to look at the main barriers to employment that disabled people were facing, particularly those with complex needs. And many disabled people find, obviously, that having a job enriches their life and makes them more financially independent. But finding work and staying in work is much more difficult for disabled people. Our research told us that 82% of people with complex disabilities are unemployed, compared with 23% of non-disabled people. That's really quite a stark figure. And only 13% of people with complex disabilities are in full-time employment. So they told us the reasons for this are wide-ranging. Obviously, some will be society's attitudes to disability and whether employers feel that they can make the reasonable adjustments for people with disabilities coming into their workplace, but also some unfair recruiting practices that people see, and whether employers are willing to look at their recruitment practice and think about making that more accessible for disabled people. A lack of suitable job opportunities, so people may be able to do 80 or 90% of that job, but there'll be a small part, and employers could carve out roles for people with disabilities, but there was a lack of opportunities there. And a failure to provide employees with the support that they needed to be able to do the job successfully. We also know that our education system often has low aspirations for some of the young people that have disabilities, and aren't giving them the specialist support that they need to go into the workplace post-19 when they leave education and prepare them for work and future. We looked at the needs around the reforms to access to work. Access to work, I'm sure most of you know, is obviously a vital way of people being able to access similar job opportunities to non-disabled people and get the support they need to not just enter work, but also to stay and thrive and flourish. There are issues with the scheme, which means that not as many people are helped as they could be. People don't know about the scheme. Employers, a lot of disabled people don't know about that scheme, and we need to raise more awareness. There's also issues around access to work being paid out on time, so people actually starting successfully in their role and not having to wait for that crucial support that's going to give them the same chances as their colleagues. But it also impacts on those people who are on low incomes if they need to find an interpreter for 3 weeks or 6 weeks or up to 8 weeks, or that money for taxis or transport to get them there. We believe that the government should work with disabled people to reform access to work, and we'll be getting in touch with Richard and his team, because we know that access to work needs to be promoted more extensively. Lots of disabled people have told us that the Disability Confidence Scheme is no more than a box-ticking exercise, and actually lots of employers will have the certificate but aren't following through on their commitment to disability confident, particularly around recruitment. And Sense don't believe that the Disability Confidence Scheme is as robust as it could be, and that all employers are living up to their commitments and promises. We know through working with the DWP that the main contact at the job centre for disabled people is their work coach. But we polled our job seekers with complex disabilities, and over 54% didn't feel satisfied with the service. We believe that people need better training around supporting disabled people to help them successful in their search for work. And that work coaches don't receive disability equality training that is specifically focused around disabled job seekers. We also found that the job search and access to work within the DWP offices, there's no access technology. So people who need screen readers, anything like that to be able to support them, specialist mice, keyboards, etc., to be able to get on and actually search for jobs in the first place and fulfill their own commitments aren't accessible. So we're asking for the government, we've costed up how much it would cost for those DWP offices to get the assistive technology needed to help more people search for jobs. And we believe that the Job Centre should create a £5 million assistive technology fund. And our research showed us that with that support, people are more likely to get in jobs. At Sense, we have specially equipped offices so that job seekers can come to us. We support them with everything from training, job searches, interview practice, and asking for reasonable adjustments within the workplace. So all in all, we believe that we need to reform access to work to help more people get into jobs, to reform the disability confidence scheme, to support the DWP work coaches to have a greater understanding of the needs of disabled people, and to invest in an access technology fund.
Great. Thank you, Rachel. We're going to move straight along to Gareth, and then after that, we're going to open it up for discussion and questions. So get those questions ready. But Gareth, over to you.
Yeah, thanks, Stephen. Try and bring perhaps more of a provider perspective to the agenda. And I think the immediate thing that strikes me is if we are genuinely aspiring to achieve an 80% employment rate, that whilst on paper or spreadsheets that might only look like a few percentage points, it is actually requires a transformational change from where we are today, not an incremental change. So I think we shouldn't underestimate the size of the challenge to do that. If we're to achieve transformational change, that means doing things differently, if that's not a statement of the absolute obvious. There are lots of organisations in this room doing fantastic work, but my overall observation, I've sadly been in this sector for over 3 decades, and a lot of us, and I include Maximus in this, a lot of us are still pretty much doing the same thing today as we were doing 20, 25 years ago. So where is that transformation coming from, and how can we create the environment for transformative delivery in what we need to do? You know, we're talking about just to put it into context, we've heard a lot today about youth unemployment, we've heard a little bit about disability unemployment. The disability employment gap is stubbornly stuck in the high 20%, hasn't moved for decades. And of course, everybody knows that we're seeing record levels of economic inactivity. So anything we do has to be scalable and have a large impact. So just some thoughts about what might be able to do. You know, the integration between employment skills and health systemically needs a shake-up. What we've seen in the UK for too long is central government departments with very large budgets commissioning provision, but any horizontal integration between employment skills and health just hasn't worked, because the beast is too big, it's too large, it's too complex, it's too slow, and it can't do. So the opportunity that we have now to accelerate the devolution agenda is a genuine and real opportunity to accelerate how these services can be integrated. So we've already seen some quite innovative ideas emerging at local authority level. We've already heard about some of the ideas being trialled here in the West Midlands, and I think we could see a lot more of that with the devolution agenda. And I would encourage that we all look at that and take the opportunity to say, how can we do horizontal integration of employment and skills and health, and just make sure we're not just commissioning vertically down, but we continue with vertical commissioning of those services locally. Integrated solutions is what it's all about. The second one is around day one provision. Pretty much, you know, we've got experience of working with city councils, local authorities, combined authorities and central government departments. And what we see getting in the way is lots of rules, eligibility rules, when actually there is provision and there's capacity out there which is not being taken advantage of. You know, lots of the commissioned services exclude people who are economically inactive. So how can we open up eligibility criteria to get the people that really need and can benefit from employment skills and health support to get them into sustainable work? So, you know, and how can we make that immediately available from day one of unemployment to make it a real meaningful difference? Too much provision requires people to be unemployed for too long before they get access to that support. So we can shake up that side of it. And then the third piece we can change and we can look at is how do we increasingly embrace technology to improve and change what we all do and how we all do it. You know, I think from our own personal experience over the COVID period, we saw lots of employment and skills providers move their services online. Surprise, surprise, lots of people developed skills and lots of people got jobs that they stayed in. It can be done even with people in underrepresented communities and disadvantaged communities. What happened as soon as COVID's finished is we all get driven back to delivering face-to-face services. And all of that learning that we got through the COVID period seems to be on hold. I don't think it's lost because we've still got it, but it's on hold. So how can we bring that learning back to modernise our services? And I think I heard somebody ask a question before from an AI technology provider. That's the last piece of that jigsaw, is how are we embracing new technologies to transform the way we deliver our services, to modernise what we do as a sector, to be more efficient, be more impactful, offer our services in a broader way to engage with more people who can have a more choice-led approach to how they engage with employment and skills support. So I think there's some of the opportunities and challenges. I think some short-term and medium-term considerations. If I can put one plea out, we are heading towards a cliff edge of employment support for disabled people here in the UK. Referrals to work and health programme finish at the end of September. There is no replacement provision currently in place for disabled people in the UK, which is the first time we're going to be in that situation for over 2 decades. So we know that the previous government administration had plans to release a programme called Universal Support to very much be devolved. Can we get on with it? Whatever that looks like, we need to get on with it because there is going to be a massive gap in provision for disabled people from 1st of October this year. So if we get some clarity from the new government and the devolved authorities about what that looks like and when that's coming out, let's get on with it. That's the short-term message. More medium-term, you know, as we move from the system of the previous administration to the new administration, can we get some clarity on commissioning strategies and what the medium to long-term approach is for commissioning, taking advantage of that? How do we embrace technology? How do we take risks? How do we create an environment where we can all develop and do something different going forward? And last but not least, I don't say this with any critical comment intended, but Job Centre Plus and Career Services cannot do this all alone. There are some amazing organisations, local, medium-sized, large national, private sector, public sector, voluntary sector, who are part of the solution here. So let's not think that JCP revolution can change everything. It needs a collective effort using the combined skills and experience of everybody across the sector.
Fab. Thanks, Gareth. The other cliff edge I'll add is that all UK Shared Prosperity Fund provision ends on March the 31st, 2025 as it stands. So there's cliff edges galore. Now, my pitch for an 80% employment rate was that other countries have done it, so the Netherlands and Switzerland, amongst others, and that's the way various other countries are heading, that this will be good for our economy and the taxpayer. So we think it would boost the economy by more than £25 billion and save the taxpayer £8 billion a year, which would free up resources to do things like try and sort out the health service, for example, amongst other things. And also that there's more than enough people that want to work and can work to get us there. So we need 2.4 million to close that gap. If you halved the disability employment rate gap, that would be 1.2 million. That's just halving it. If you halved the gap between the highest and lowest employment rate areas of the UK, that'd be another 400,000 people. My list goes on. You'll be glad to know I'm not going to go through it all. But there's enough people, there's 3 million people in total who are out of work but want to work. We need 2.4, so we can do this, but it will definitely take transformational change and at least a decade to do. It's not something you pull a lever and do overnight. So that's my pitch for that, and we look forward to working with the new government on that ambition that they've committed to. So have we got sort of questions, thoughts, comments? Yes, I can see 3. We'll try and take the 3 together. So there's 1 at the back and then 2 just on that table there. So we'll take all 3 together and then come back to the panel.
Patrick Craven from City and Guilds. And I've got two sort of questions, if I can, please, in terms of trying to address that and get to that 80% target. And I think some of this touches on the points that were made there about if we continue doing what we're doing, we're unlikely to turn the dial very much unless we think of new ways of approaching it. And with the economically inactive, one of the thoughts that occurs to me is how do we make them more visible and accessible? Because by definition, I don't think they're going to be turning up at the types of institutions and places that we normally engage with people. So that's one part of the question. How do we reach those people? And then the other thought, I think there was a reference made to a number of people who are in jobs and stuck in jobs. Is there anything that we could do to expand careers advice and services to people who are in work, who might want to upskill or change career, which might then free up entry-level jobs for people to come into as well? So not just looking at those that are out of work, how do we sort of free up the labour market to make it more fluid?
Thank you. And there was somebody next to you, right next to you there. Yes, please.
Hi there, Emma LeBlanc. I work with local government. You want to increase the employment rate by 80%. However, you know, we've got childhood poverty, for example, and I work with people, some who are employed, and many of the residents that I work with are in work poverty. And the government is subsidising in work poverty already. What are we going to do about it? Also, we've got things like housing. Housing is very, very expensive, so some of the residents that I see, they don't want to work more than 16 hours because they're going to lose their housing benefit. And work for them, and for many people, does not pay. And we also know, for example, that salaries for about 20 years, they haven't risen in line with inflation. So we can try to encourage people to get into to jobs, but what type of jobs? Are we going to encourage them to continue going into low-paying jobs? Another question, I'm a trained careers advisor, and many careers advisors are paid really poorly. So what are we going to do about that too?
Right, some nice, easy questions for us to tackle there. And then there was just one question at the back as well.
Hi, I'm Louise Rowland and I work for UFI, and we're a charity that's focused on how technology can help adults get the skills they need for work. I had 2 points, and one, I was really kind of struck, Rachel, by the statistic you gave there. I've done some Googling and some quick maths. So apparently last year the total budget for the DWP was £279 billion, and we need 5 million to get assistive tech. So call to action. We probably all need to do more to pull that out a bit. But to me it points more to what we've been talking about today, about the systemic change we need to get to where we need to get to, which leads to your point, Gareth. My reflection is you're right around realising that we are, it's not just the labour market that's going through a transformational change underpinned by digital. We are part of that labour market and that economy. So what advice have you got, or encouragement to how, so that people can understand the benefits of that digital transformation, and what encouragement and advice would you give people to begin that and to champion it in their organisations?
Fabulous. Well, you've all shoehorned in 2 points/questions there, so well done for efficiency. So let's, good luck, panel, answering all of that. I'm going to sort of give you free rein to try and cover which points you want to. Don't try and cover them all, because Pete, you're the last thing standing between everyone in this room and a cup of coffee and a biscuit. So should we just go down the line and pick up any questions you want to? If we've missed any, I will come back then at the end.
Yeah. So, clearly a lot of questions that are sort of more aimed at people who are expert in the employment field, and my expertise is in the health field. So I am going to focus in actually on the middle question, which started with the issue around poverty, because I think at the Health Foundation, we're an independent charity. We do research on sort of what's happening with health, what's driving health, how we can do things to improve health and reduce inequalities. And fundamentally, we know the NHS is there for when we're ill, but when we're thinking about what keeps us healthy in the first place, it comes down to, the money in our pockets, the quality of the jobs that we do, the quality of the housing that we're living in, the sort of food that we can afford to put on the table, and so on. So I think it's really interesting how this theme around poverty has kind of come up in this question, and the fact, as you say, that whereas in the past the rhetoric was always work is the way out of poverty, we know that's just not the case at all. So I think this is why, sadly I think that, there aren't going to be any quick solutions to this sort of working age health challenge that we have, because actually they're stemming from some very deep and systemic things around the sort of low pay economy that we have, around the high costs of housing and that eroding into people's sort of incomes to spend on things that are sort of value adding to their health and so on. So I think that what we've been saying at the Health Foundation is we need to look at this as a sort of whole society challenge, and that means looking at it as a sort of whole government challenge. And We know Labour have got their 5 mission boards that they're going to be setting up, and one of them is around health. But at the moment, there's a risk that's quite narrowly focused on sort of improving the NHS, which is clearly important, and people want that and need that. But we've got to be looking broader. And one of the things that I think the government needs to think about, and this is perhaps where it has benefits to the sectors that are represented in the room, is how do we invest better in prevention? So not just, the sort of traditional health prevention of helping people stop smoking, but how do we prevent people falling into ill health in the first place? And things like getting people into a job is one of the best preventative activities we can do if it's a good job. So we need to be finding ways in which government can put some protection and ring fence around the sorts of interventions we know ultimately give payback and benefits to society, rather than what we're doing at the moment, which is putting all this money into the sort of services and responses we need to failure, whether it's failure in housing or failure in employment or failure in health. So I think that for us is one of the messages we're going to be really pushing, is the need to think about how government can think differently about prevention spending across a whole range of government activities, protect it, ring fence it, and recognise that the payback to that is going to be over the long term.
Great, thank you. Yes, and we probably need a 3-day conference to cover all health services, building 1.5 million homes, raising the minimum wage, raising standards of employment protection, and so on and so forth. But these are all very important things, and some of them we will cover during sessions the rest of today as well. I noticed the Health and Social Care Secretary, Wes Streeting, talked yesterday about that department being a department for economic growth as well as a very important public services, which plays to some of the things you were talking about. We'll just carry on down the line. We are a little bit short of time, so I will encourage brevity if I may, but Fiona, over to you.
Yeah, I think I was reflecting the fact that there are lots of questions forced into those 3, and the fact that they were so multifaceted is because the challenge is really multifaceted. We've got to think about who and where people are and what their challenges are, how to support them, but how to make sure there are enough good jobs that they can move into, but it's financially viable and they're healthy. And I think for me, that sense of working in a place is really important, and thinking about how we put all of those services together around a person, and then we think about how we create good jobs within a region in order that they can move into. So no specific answers on those, but I think as long as we continue to work in silos and tackle these questions and issues separately, we are not going to crack them. And it's only when we bring them all together and say, what does this person need and how do we put it around them rather than our own organisational silos, are we really going to make that sort of difference?
Great, thanks. Thank you to the lady at the back that did the maths for us. So as you can see, it's quite a simple solution. And the solutions that we look at Sense are all around access. So the access technology that people need, actually a lot of it's already built into the iPads, to the technology that we have. I can dictate my my emails myself. It just needs that knowledge and information to be transferred to the people at the DWP, and a little bit more investment, or anyone who is supporting disabled people through job coaching. Equally, we've seen a real uptake on our virtual service. So as I said, we're funded, we don't have constraints around specific, very strict criteria about how we can support people. We've seen a real uptake in our virtual services. I mean, just for a starter, you don't need to find a parking space to go and access that if you're online. But so many of us are working online virtually. We can do virtual interviews. We're embracing that technology for ourselves, but are we really, really building it into the way we recruit people and to think about disabled people accessing jobs within our organisations? And lastly, some of the things Sense have done is in our arts programme, for example, we've committed to 50% of our freelancers being disabled artists for our arts programme. If they're not there, we're working with them as volunteers to create a funnel so that people can come through and start to get paid for the work that they do. And we're looking for people with lived experience in some of our key roles within the organisation. So we're just trying to think about all the different points where disabled people can access employment through our services, or we can help employers to think of those too.
Thank you. Gareth?
Just a few high-level points. So the Good Work agenda is clearly a critical part of all of this. If we link that back into employment support, Too much employment support finishes a certain point and sees people, all its focus is getting people into a job, not a career, so the any job agenda needs to progress onto a career agenda over a period of time. I think there's something around the way systemically and societally we see unemployed people. We see them too often as a cost and a burden, not as people who need support and investment. And we need to change the mentality of that. And if you took a behavioural science approach to the way we support unemployed job seekers and people with complex needs, I'm sure we would develop a very different approach. And this idea, if you don't do this, you get penalty A, and if you don't do that, you get penalty B. Well, let's have more carrot and less stick. As a general statement. And just picking up on the point about technology, I think in our organisation what we're trying to do is give it a go. Just encourage people to give it a go, even if that's using Microsoft Copilot or there are other AI software solutions out there. But just give it a go. We're trying to create a bit of a bottom-up groundswell. At the same time, what we are trying to do is experiment with solution designing, with utilising new technologies. Have to say that's incredibly difficult to get commissioner approvals for that because everybody's obsessed with GDPR and data protection, which clearly is a concern. But somehow we've got to unlock some of those rules and put a bit more trust in the system for providers to say, we trust you as a provider, we trust what you're doing. As long as you satisfy us, you're sensible, balanced, and you've got the protocols in place, you can have a go at trialing new things. We need to break some of those barriers down because that's how we're going to unlock, that transformational change from a delivery perspective.
Great, thanks Gareth. I think there's definitely a conversation we need to all have about what 21st century public services look like. So we will come back to that without doubt. And a massive thank you to all of our panellists and to all of you for some excellent and very tough questions. I'm glad I wasn't on the panel having to answer some of those as well. We're going to move to a break in a second. Do go and grab a cup of coffee or a cup of tea. I don't actually know if there's biscuits, so I'm sorry if I've overpromised there. There must surely be some biscuits, surely. We can find some biscuits. I'm seeing some, we'll find something. But also go and talk to the exhibitors and go and have a look around there. We're going to be back in here for the next session to start at 11:50, please. So in the meantime, can you just finish by saying a massive thank you to our panellists?